Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we are on a mission to help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Jayna Gandhi with us. She, with her 11 years long experience with working as a specialist in pediatric dentistry, is here to help us understand how a person can work as a specialist in pediatric dentistry, as well as how did she carve her journey during this while, and what is the scope in the branch. Welcome, doctor, to the platform. It's really nice to have you here and to discuss about such an interesting topic.
Thank you so much, Dr. Ayushi, for having me on board. It's a real pleasure. And I believe the Social Doctor is a great platform to connect with all the doctors here.
Yes.
So thanks for time.
Yes, thank you so much for this. So now let's understand your journey. How did it start, and how did you, end up here now being such a successful doctor?
Well, like Dr. Ayushi mentioned, I am a pediatric dentist with more than 11 years of experience post my graduation. And I am literally in love with my field. I'm very passionate about pediatric dentistry. I have been associated with the reputed dental chain Clove Dental and was working as a deputy zonal head over my last stint in the last couple of years, and was handling a major part of Gurgaon zone for them. I was also taking care of trainings and hiring workshops for them. And apart from that, apart from my passion in pediatric dentistry, I then eventually moved on to become a consultant across a few select clinics in Gurgaon. So that has been my journey so far.
Yes. So, nice to know about all of this. So why did you pick up pediatric dentistry? What was your call for that?
Well, I'll be very, very honest. I still remember my counseling session, and I was getting all the branches in dentistry at the time of my counseling. And from my graduation days, only afterwards I did my internship, I was very keen on picking up only pediatric dentistry. And it was something because I always felt that connect with children. And I believe that, when you can bring a smile on the child's face, the parents, the entire family becomes your patient eventually. So that was one thing that actually drove me towards that. And I was very, very clear that I want to pick up only this field during my PG.
Okay. Maybe that might have come from your love towards kids, but yes, but I'm sure it's a nice branch to get into. So now, when you have been working for so many years, what do you see the scope and the future in this branch? How has it changed over the years?
Yes, well, absolutely, Dr. Ayushi. Initially, people were not really aware, and they would take their children to a general dentist. But now, if you see, the awareness has increased many folds. Parents are very much concerned about their child's health. Earlier, there used to be so many children in one family. Now they're all nuclear families with one or two kids, and every parent would want to do the best for their own child. So, now I have seen that in NCR region, and I'm sure in other regions as well, even if it's for a basic treatment, as basic as a fluoride treatment, they would specially call and ask for a pediatric dentist, because nobody would want to take any risk with their child. So they want the specialist for their child. So that is how the awareness has increased. Parents now want a specialized attention. And of course, I believe that with this field, once the child comes to you and you treat the child, if the parent can trust you with their child, eventually they end up trusting their own treatments, their own cells, their own other family members as well. Correct. So the scope has definitely increased from what it was earlier. And I believe it is your passion, it is your grit on how well you communicate to the parent, what kind of an attitude you instill in the parent. And again, with pediatric dentistry, in other fields like you're practicing implants or any other branch, once you do the treatment, then the patient is gone. Of course, he needs to come back every 6 months for a cleaning or polishing. But with children specifically, once they come, their milk teeth are going to fall. Each year, something new is going to come up. Even if there are cavities or certain other treatments, you would need to do a consistent follow-up for them, because they're undergoing dynamic changes. So once a pedo patient comes to you, a child patient comes to you, he will keep coming to you every 6 months, provided you have communicated correctly and instilled the right attitude and behavior towards the prevention of cavities and towards the preventive dental treatment in them. So correct. That is one major part of it.
Correct. And that's so true, with the upcoming specialization in each branch.
Exactly.
Pediatric is one of the major ones. So as it is increasing, the scope is increasing. If a dentist picks, chooses pediatric dentistry as their specialization, how can a dentist get established in a metro or a non-metro? What is the scope in both of the places?
See, again, in both the places, I would say that, even if you're starting as a general practitioner, make sure that every patient who walks into your clinic, talk to them about their children. Everybody has kids in their families. So if you tell them right now, like I said, that maybe awareness is increasing, but still it is our duty to tell people about this specialized field. So whenever a parent or an adult or, an old patient walks into the clinic, talk to them about, you have kids in your families, and it's very important to maintain the milk teeth of the teeth. You instill about the facts that the importance of milk teeth, why they are important, how they're going to lead to the healthy permanent dentition eventually. So you talk to them. Communication is the key. That is very, very important.
Right.
Ask them to come for regular follow-ups every time. And then eventually, once you have established that trust in them, and then they will eventually, the follow-up will automatically increase on its own.
Yes, 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 that's true. So now when I mentioned, instilling the habit and the awareness is one part. But if a person wants to pick up as a specialized practice in a, in a metro or a non-metro, how is the scope in both the places for a specialized practice?
See, in a metro, definitely the scope is very, very high. There are right now very few exclusive pediatric dental clinics across NCR. So if you establish yourself as an exclusive pediatric dentist, it is definitely going to do very, very well, because people nowadays are looking. There are just 2 or 3 niche practices which are doing it. And with procedures like conscious sedation coming up, we have zirconia crowns coming up, which are metal-free crowns, which are done in children. Demand for aesthetics increasing, and the early childhood caries also increasing drastically among children. So the scope is really very high. When you establish yourself as a pediatric dentist, you can also make sure that you create that kind of an environment. You create that a recreational facility along with your basic dental setup, and include all those additional things which a general dentist is not doing. So once you add all those things to your practice, definitely there is no looking back to it. Whether it's a metro or even if it's a non-metro city, everybody wants the best for their children. So definitely there is a lot of scope. Dr. Ayushi, your voice.
Sorry. Yes, nice to know about, establishing a specialized practice. And that's true. There are very limited branches in dentistry where you can establish a specialized practice, and pedodontics is
pediatric dentistry being one of them.
Yes. So now if a person wants to, but what is your suggestion as a practitioner, as you have worked for 7+ years in a well-established corporate setup as well, and right now you're working as a consultant? How do you think is the right, what is your take in practicing? What will you suggest the upcoming doctors to practice? How should they start their practice in general?
Well, again, like I said, that people still have this itch initially that, you should not opt for pedo, you must go for implantology or orthodontics. They are more well-earning fields, but I think you should not think like that at all. Pedo is a very, very upcoming field. And once you establish yourself, so whenever you can create your own practice setup, and you can, start with tie-ups amongst various schools. You can, social media is the need of the hour, need of the day. You can talk about them, create your own blogs, talk about the importance of how to brush their teeth. There are, so, connect with pediatricians as well. There are a lot of pediatricians who would not recommend the children to be taken to a dentist. And there are a lot of times parents come to me and they say, my child is 3 years old. And when I ask them, when did you start brushing? They say, no, we haven't started brushing their teeth as yet.
Okay.
So something, instilling in them and telling them that, no, you have to start it as early as the first 2 theraps at 6 months of age. So these are things which people are not aware of. So connecting through the social media, tying up with various schools, connecting with pediatricians in that region, or even in your RWA, talking about it, and then eventually, marketing about it and telling everybody about it, and then creating awareness and calling them to your own setup. So that is what is there.
Yes. And some really good points that you have mentioned about for establishing as a dentist. I'm sure, if implemented, can do wonders.
It can absolutely do wonders, without a doubt.
So now, if a pediatric so what are the courses and fellowships? Are there any kinds of courses and fellowships for the pediatric dentists to become better practitioners on a longer run?
So yes, of course, like newer things keep coming up every day. There's a newer technology called SDF. Again, not many general dentists are aware about it or using it. This is basically used to arrest caries. So you can read about that and study that. Courses on conscious sedation, that is the most upcoming thing in the market as of now, because nobody wants to see their child in pain, or nobody would want, even if you're best at behavior management, nobody would want to see the child undergoing a lot of discomfort, or, not being happy at the visit. So courses on conscious sedation are there at many places within India. Only a lot of practitioners who are doing it, they're also conducting their courses. Apart from India, if you want to go abroad also, there are a lot of postdoctoral fellowships in places like Toronto, in the Sick Kids Hospital. And so, but of course, if you want to settle yourself here in India, these are the few basic things. There are courses that are being conducted on zirconia crowns as well. Then you can also, pediatric dentists have one more special thing, that they specialize in treating special children with handicapping conditions, right? So that is one niche thing which not everybody is doing. So you can also, contact various centers which are taking care of special children and their needs. And that is how you can make it a completely niche and specialized practice. Something which not every, I would say, not many general dentists are doing at this point of time.
That's true. That's completely true. So now, if a pediatric dentist want to get settled out outside India, what is the kind of scope outside India? Is it valued there as well?
Absolutely, absolutely. Like I said, that children, I'll give you a very little example. I took my son to a pediatrician, and he said there are two vaccinations for a particular strain of bacteria. One will kill 7, the other will kill 12. And the vaccination which will kill 7 strain of bacteria will cost you 5,000, the other will cost you 9,000. So do you think I, as a parent, would even think once of, giving, saving 5,000 bucks or 4,000 bucks on the fact that, no, I want to, save money on that thing. So every time I say that pediatric dentistry is something, a person might not spend that much money on himself, on getting treatment for his own self. But when it comes to his or her own child, they would not even think twice, provided you are explaining to them the correct need, the reason of why it needs to be done, what will happen if it is not done, what are the benefits of getting it done, and what are the long-term eventual sequelae and consequences of, getting a regular checkup done. So again, abroad also, in India, when the awareness is increasing, abroad people are very much conscious. So their regimens are completely fixed, that every 6 months you have to get your cleanings and scalings and polishing done, and you have to get your preventive treatments done. So even if you go abroad, of course, this is a very well practiced field. I have a very good friend in UK. I was speaking to her yesterday only. Yes, of course, you need to clear a couple of exams. That thing is definitely there. Like in UK, you have to clear your OREs first, and then either you do a post-graduation degree for 3 years, or you do a training course for 3 years, and then take care of your RCS exams. But at the end of the day, it is all very fulfilling, and it is all very well paying. In countries like UAE, there you just have to clear the exams. You do not have to study further. And once you get a license, you can then eventually practice.
Yes. That's true. Clearing examinations is definitely important.
Absolutely.
But yes, the understanding that there's a lot of scope is also one thing really important.
Yeah.
So now, as you mentioned before also, that the general dentist very rarely, treat the pediatric cases. Is there any suggestion from your end for the general dentist to take care of the pediatric cases? What are the best practices that they should do on a general?
So I have seen a lot of general dentists who would send away the pediatric patients thinking that, no, we can't treat them. I would suggest, even if you can't treat them, please call a pedodontist. But don't say that these are milk teeth and these are eventually going to fall out and they do not require treatment. So giving the parent the correct knowledge is very, very important. Correct diagnosis is very, very important. So do not think that this is something which is not important. If you tell the parent that the importance of that treatment, the need for the treatment, how it is affecting the child, it's very, very important. I also give a very a good example about my own thesis. I'll just share it with you, that your oral health has a great impact on your general health. So children who have early childhood caries or severe early childhood caries, their height and weight as compared to healthy children of same sex and same age and weight, a healthy oral condition is much lesser. And once you treat those children, they develop or demonstrate a phenomenon of catch-up growth. So if a healthy child would go from a 14 to a 16 kg, and if a carious dentition child was 12 kg at that point of time, once treated, the 12 kg child would also gain equal amount of weight and would reach 16 kgs. This is also associated with iron deficiency anemia at one point of time. So if you tell them, if you share facts with them, if you show them, published studies, or you talk to them about it, so then definitely they will understand the importance. So even if you don't want to do it on your own, don't neglect it, don't ignore it, don't say that this is not important or this is not required. So once you tell them, you can definitely call a specialist over and get the treatment done.
Definitely.
Yeah.
So the idea is to build awareness is a community thing.
Exactly. Build awareness, build trust, build that rapport and faith. And believe me, once the child, comes to you and is comfortable with you, the child only brings the parent back to you. Yes. So he will only say that, I want to go to that particular doctor. I want to get myself treated. And once parents also see that the child had to go through so many things, so I tell them that generally they will come when there is pain in the tooth. Mm-hmm. But when they come, you also tell them there are few other things that the child requires. So if they start coming regularly, then definitely you would be able to tell them that, right now a cavity has just started and we can fix it at this point of time. Interceptive orthodontics is one field which is again neglected, because general dentists, if you are sending the pedo patients away, of course braces can be done, but the complexity of treatment would always be severe. So if they're coming at a younger age, suppose there is a cross bite at that point of time, you can correct it, before it worsens, and then you have to do complex treatment at a later stage, you can correct it there and then. So if you're seeing the child every 6 months, you can save him a lot of discomfort at a later point of time.
That's true. Now, when you mentioned about interceptive orthodontics, so what is it, if you can elaborate on that?
Absolutely. So interceptive orthodontics, as the name suggests, is that you are intercepting the need for ortho. So it doesn't mean that you will completely eliminate the need for ortho, but somewhere you will reduce the need or reduce the complexity of the treatment. So your space maintainers, your space regainers, your myofunctional appliances, your habit breaking appliances. A lot of children these days have mouth breathing issues. So many children have issues of bruxism. Every second child these days needs a night guard. So, figuring out whether any breathing issues are there or not. And if you correct them at that particular point of time, of course, the dentition, the overall jaw development, facial development would be much, much better. So these are all unexplored areas, which, of course, as a pediatric dentist, people are practicing and doing. But as general dentists, this is something which is neglected. So if this is also taken care of, parents, who wouldn't be more than happy to avoid complex treatments at a later stage?
Definitely. That's true. And this is also, what I understand is the future of pediatric dentistry coming.
Absolutely. These are the unexplored areas. So that's why I always say that don't think that this field is not going to give you anything in return. I think it's a very, very upcoming field. And in fact, you must opt for this. And I think we should all work together to increase the scope and future of pediatric dentistry in our country.
Definitely. So now, any words from your end, to help the dental graduates to understand, to pick up this branch, and what motivated you also to pick up this branch? Something that, any motivational quote from your end to motivate everybody?
Well, for me, it was my professor, because when I was doing my internship in Pedo, I had a lovely time. I really enjoyed working with kids. I have always had that connect with kids. Of course, passion for kids, feeling that connect with kids is also very, very important, because there are a lot of people who say that, we will not be able to handle them or treat them. Yes. So that having that connect is very, very important, because treatment at the end of the day, eventually everybody would do. Behavior management is something which is, again, an art. So we all know how to do a root canal. We all know how to do a filling. But then getting a child to sit on the chair, managing the child, and building that trust with the parents. So it's always a pedodontic triangle: the parent, the child, and the doctor. So we all have to work in association with each other. We all have to build that trust and rapport eventually. So that is something which has to come from within. Apart from that, I believe your passion, your grit, your perseverance, and the fact that I can do it. There is nothing difficult. We keep on saying that this field is super saturated, dentistry is super saturated, but believe me that we all have the potential to excel in whatever we do. So if you have the right mindset, if you think you have to do it, you will be able to do it. There is no looking back towards it. Yes, of course, it takes time, patience, and effort. And it's a learning curve. Learning never ends. And for us as doctors, I think with each new case, you learn something new. With each new root canal, you learn something new. With each new child, you learn something new. You know, this is how the child behaved. This is how I managed, and this is what worked for me in that particular situation. So it's a growing curve. Just keep that passion in you. Just keep thinking that I have to do it. And believe me, you will be able to do it. And never think that, why we came into this field and we are not going to be able to achieve, success. We have seen so many well-running practitioners across us. They have also risen from a very, small stage to where they are at this point of time. So keep yourself dedicated and work hard. And I think there is no looking back towards it.
Correct. That's so true, and such golden words. I must tell you, something that she has mentioned that I'm sure will motivate many students out there. And thank you so much, Dr. Jayna, for helping us to understand about this field in depth, understanding how it can help in the growth and the scope behind it. How can every dentist who picks up this branch can understand this future and his growth in this branch. So as she mentioned, it's a really upcoming branch. If you are planning to pick up this branch, do that, because currently the pediatric dentistry is something that people are looking forward to. Specialization in this branch is also coming up. So if you want to set up your own specialized clinic, I'm sure it will do great in that.
Like we said, we would not really see a lot of specialized ortho or implant clinics, but a specialized pedo clinic is something which, if somebody gets to know there is a place only for children, everybody would love to visit. Even when we go to pediatricians, we now go to pediatric dermatologists, pediatric nephrologists. So pediatric dentistry in itself, we do not have a super specialization as of now, but I think in itself is a very, very vast field. Definitely. Plus, when you're a pediatric dentist, you're doing everything. It is one field where you're learning every other field. You're doing prostho, you're doing endo, you're doing interceptive ortho as well. So somewhere or the other, you are grooming yourself up to be, you can, even if you're doing general dentistry, you are very well equipped with all the knowledge for practicing every particular field of dentistry.
Correct. Thank you so much, Dr. Jayna, for helping us to understand about such an interesting branch, and as well as enlightening all our viewers with the scope of this branch. I'm sure it will help so many students out there. Thank you so much.
And thanks a ton, Dr. Ayushi, for having me over on this platform. It was a real pleasure. Thanks a ton, everybody.
Same here. Thank you so much, everyone, for joining us at this time. I'm sure this discussion will be really helpful to each one of you. Do share it with your friends and colleagues who are looking forward to do their masters or are into periodontics, to help them understand about the future of this branch and what they can look forward to. Do also follow us on our YouTube as well as Instagram channels. There you can find all our old videos, which can also help you in your career growth. Thank you so much, everyone, as well as Dr. Jayna, for helping us to understand another important topic. I'm sure it will add, good vibes and good thoughts in all the upcoming dentists out there. Thank you so much, everyone. Thank you so much, Doctor.
Thank you.
Bye, everyone. Have a good day. Bye.